What are preeclampsia and eclampsia? Preeclampsia is a serious blood pressure condition that develops during pregnancy. People with preeclampsia often have high blood pressure and high levels of protein in their urine. Preeclampsia typically develops after the 20th week of pregnancy. It can also affect other organs in the body and be dangerous for both the mom and her developing fetus. What causes eclampsia? No one is sure what causes eclampsia. It may be related to the development of the placenta or poor blood flow to the placenta. Genetic factors, inflammatory changes in the body, blood clotting abnormalities, brain inflammation, or hormone imbalances may also be factors. What are the symptoms of eclampsia? Seizures are the most notable symptom of eclampsia. Pregnant or postpartum persons may experience seizures that last 1 to 2 minutes. During the seizure, they typically experience facial twitching, have a series of rapid, body-wide muscle contractions and relaxations, foam at the mouth, become unconscious for a short period after the seizure, act confused or agitated after regaining consciousness, hyperventilate during seizure recovery, have no memory of the seizure. Some experience seizure-related complications, such as biting their tongues, hitting their heads on the floor, and breaking bones due to falls. What are the risk factors for eclampsia? Pregnant persons are at increased risk of eclampsia if they have never been pregnant before, are pregnant with twins or other multiples, have a personal or family history of preeclampsia, eclampsia, are teenagers, are age 35 or older, experienced fetal growth restriction or stillbirth in a previous pregnancy, had placental abruption in a previous pregnancy, have a pregnancy affected by fetal growth restriction, have obesity, have pregestational diabetes, have lupus or other autoimmune diseases, have kidney disease, had hypertension before becoming pregnant, have vascular conditions, had in vitro fertilization. What happens when you have preeclampsia? When you have preeclampsia, your blood pressure is elevated higher than 140/90ths of a millimeter of mercury, and you may have high levels of protein in your urine. Preeclampsia puts stress on your heart and other organs and can cause serious complications. It can also affect the blood supply to your placenta, impair liver and kidney function, or cause fluid to build up in your lungs. The protein in your urine is a sign of kidney dysfunction. What week of pregnancy does preeclampsia start? Preeclampsia typically occurs after 20 weeks of pregnancy, but it can come earlier. Most preeclampsia occurs at or near term 37 weeks gestation. Preeclampsia can also come after delivery, which usually occurs between the first few days to 1 week after delivery. How can I reduce my risk of getting preeclampsia? For people with risk factors, some steps can be taken before and during pregnancy to lower the chance of developing preeclampsia. These steps can include losing weight if you are overweight, obese, controlling your blood pressure and blood sugar, maintaining a regular exercise routine, getting enough sleep, eating healthy foods that are low in salt and avoiding caffeine. Thank you for joining us on this pregnancy journey. Subscribe for more insightful discussions and tips. Wishing you health, happiness, and endless love on your parenthood adventure.